bottle cleaning, bottle sterilization, milk formulation, baby feeding, and burping. Okay, so before we do any procedure, first we have to do the proper hand washing. Okay, and then after that, we have to gather the materials needed. So we'll do the bottle cleaning first. So we will be needing 2 basins. One basin for soap and water, and the other one is for the clean water. We also need, of course, the bottle that we will clean, the calibrated feeding bottle. We also need the bottle brush, nipple brush, sponge, and soap. And of course, we need the rubber mat to avoid the wetting of the table. So let's prepare. So of course, we have to put the soap in the water. We have to dismantle or disassemble the bottle. And then, so we have to, of course, we have to put soap and water in the table, in the bottle, and then brush. So make sure that there will be no residue that will be left behind in the bottle to prevent contamination. And then we will use the sponge to clean the outside part of the bottle. Put it in the clean water. Next, the cup. Same procedure with what we did in the bottle. And then we will use the nipple brush for the nipple. So make sure that you will remove all the residues that are left behind here. So if ever that the residue will not, it's not removed using the nipple brush, we have to flip our nipple. Okay, and then clean. And then don't forget, after flipping, don't forget to put it back. Okay, so once we're done with the soap and water, let us throw the water in the sink and then set aside and then clean or wash thoroughly with the plain water. Okay, and then after washing, we have to put it in the rack to dry it. Okay, and then throw the water again to the sink and then aftercare. So after that, we will proceed to our bottle sterilization. Before doing the bottle sterilization, wash your hands again and then gather the equipments you need. So we need the casserole, stove, tongue to hold the bottles because it's hot, and of course our feeding bottle and the bottle rack. Okay, so we need to fill our casserole with 3/4 water, and then we have to put inside the hard parts of our calibrated feeding bottles. And before we put the bottle inside, we have to fill in with water so that it will not float inside. Okay. So after putting it inside, we will turn on the stove, high heat, and it should be boiled 25 to 30 minutes. So after 25 minutes of boiling, we will put our nipple. Okay. So the nipple will just be boiled for about 5 minutes because it's soft and it might melt. And always remember that when you're opening the casserole, it should be opposite you, okay? To avoid the steam coming onto you. Okay, and then, so let's wait for 5 minutes. And then after 5 minutes, turn off the stove, let it cool for some time, and then open it. And then, let's put the bottle inside the rack. So make sure you will not touch the feeding bottle because it's already sterilized. So, we're done with the bottle sterilization. So while waiting for the bottle to dry, so of course, aftercare again and wash your hands again. And then, let's move on to our milk formulation. So wash your hands properly again, and then let's gather, of course, our feeding bottle. So the calibrated feeding bottle, so distilled water or hot water, it depends on what the baby needs. Our spatula or leveler, and the milk formula. So before we do the milk formulation, first we have to check the doctor's prescription for the ratio or for the correct measurement. Or if ever there's no prescription, we can ask the mother for the correct ratio, or if the mother doesn't know, we can just check the label in our milk. And don't forget to check the expiration date of your milk. And then, so let's start. Say for example, the ratio is 4:2. So that means we are going to put 4 ounces of water and 2 scoops of milk formula. So I will start. In putting the water in our bottle, we have to make sure that our bottle is in the flat surface, to make sure that the water is correctly measured. Okay, and then let's have the 4 ounces, and then so 2 scoops. So while scooping the milk formula, make sure not to press it, because to have our correct ratio. So it should be just normally scoop and then level. Okay, and then put it inside. And then another one, same procedure. Scoop and then level. Of course, we have to cover. And shake it gently, roll it gently, or shake it gently. So let's avoid forming bubbles, because it forms gas and it might make our baby constipated or having like a stomach ache. And then, if you use hot water, you should check the temperature first before giving it to the baby. So we can use our dorsum to check the temperature, because our dorsum is sensitive, so we can detect if it's still hot or not. After doing the milk formulation, of course, we have to wash our hands again before we proceed to the baby. Okay, so say for example, the bottle is ready, so let's move on to our baby in the crib. Okay, let's take our baby. Okay. In feeding the baby, we should have 2 bibs or 2 towels. So one is to cover the chest of the baby, of course, to avoid the spilling of the milk. And the other one is for burping. Okay. For an infant, it is the advised milk formula for the baby is, it should be just 2 ounces for every 2 hours. Okay, so baby. Once we're done feeding the baby, so let's do the burping. So don't forget to put the towel in your shoulder, or so just if in case the baby will maglumungad siya, so it will not go directly to the nose. And then so let's put the baby this way and then tap his back. So if the baby is not burping, reposition. And then do the same procedure. Tap. And if it's still not burping, so we can also position the baby in the upside down position. Okay, and then tap the baby again until she or he burps. And then after that, so of course the baby is done. So let's put occur in the feed. So after feeding, it is better, it is advisable to position our baby in its left side position to avoid aspiration. So we can put pillow or something that can support the baby's back. So like that. And then, that's it. Thank you. So, I forgot. After that, of course, we have to do the proper hand washing again.